Whenever a lady becomes pregnant, she has to consult a gynecologist. She has to report to the hospital there where she will have her preliminary investigations, examinations, everything. And another investigation that is of utmost importance is ultrasound scan. Ultrasound scan has got its uses at various stages in pregnancy, and the first scan that she needs to do is as soon as she gets pregnant, which can be around like 6 to 8 weeks. Why it's important is because we need to know whether the pregnancy is inside the uterus or it is implanted anywhere else. And if it is anywhere else, it is called the ectopic pregnancy, which is a life-threatening condition if not diagnosed early. And the second use is to date the pregnancy, because not all women have regular periods. So suppose in case of irregular periods, it's not possible to confirm the delivery date depending on the last menstrual date. So in those cases, we have to depend on the scan to date the scan. Second is to to diagnose higher order pregnancies like twins, triplets and all. And also we can diagnose uterine conditions such as uterine fibroids, adenomyosis, ovarian lesions such as ovarian cyst, etc. in this first scan that she goes through. And the second scan is scheduled between 11 and 14 weeks, where it is done as a part of the screening tool for Down syndrome and other chromosomal abnormalities. And the third scan is the anomaly scan, which is usually done between 18 weeks and 21 weeks. Here, a head-to-toe examination of the fetus and the fetal environment is also checked. Here, the structural abnormalities of the fetus is checked and not the intellectual status. And the last scan for the pregnancy is timed after 28 weeks, where the growth of the fetus is ascertained, and also the placental location, the amniotic fluid volume, and also using a mechanism called Doppler, we can assess the fetal circulation. So these are the normal 4 scans that we use in pregnancy to understand the fetal condition, and also to come to know whether the maternal conditions have any adverse effect on the fetus. But this 4 number is not fixed, because if the conditions arise like decreased fetal movements, bleeding, brown discharge, in those situations we have to depend on scans irrespective of a normal scan earlier. So usually if it goes uncomplicated, 4 scans will do.